Hello friends, this video is about correct identification of patient. Mismatched sample or unlabeled sample is one of the commonest preventable error in the laboratory. The main reason behind this is failure to identify the correct patient or correct sample. The phlebotomist or technicians are responsible for correctly identifying the patient and samples using two unique patient identifiers that includes the patient complete first and last name, medical record or hospital number, and or date of birth. The patient location or room number, bed tag, and charts are not reliable forms of identification and should not be used for patient identification. Every patient must verbalize or his/her name to the phlebotomist if able to do so. This means that the patient should be able to tell his own name if he can tell. It is not acceptable for the phlebotomist to ask the patient to confirm his or her name that is told by the phlebotomist. Please do not read the patient name on requisition form and ask the patient to confirm it as yes or no. Health professionals should use open questions when asking patients to state their identity. Patients are often keen to be helpful and answer yes without paying full attention and may not be aware of another patient with the same or similar name or may be heard of hearing. For example, the phlebotomist should say, "Would you please tell me or spell your name with birth date?" The identity details should match those on the request form. If the patient is in hospital or is admitted, check the information on the patient wristband and confirm that the name and the hospital number or medical record number matches the patient information on the test order. Never rely on identification attached to a bed, chart or door. Never draw a patient whose identity is not established or is in conflict. If there is a discrepancy or the identity cannot be confirmed, the phlebotomist must stop and seek assistance to have the discrepancy resolved before proceeding with the venipuncture. If the patient is outpatient and does not have wristband, ask the patient to state the patient's date of birth. So what are the important patient identifiers are name, hospital number, date of birth, address and gender. These are important patient identifiers. Here are some positive patient identification that should be confirmed before doing a venipuncture. First, ask the patient to state their full name. Second, compare it with identification band. Third, ask parents or attender to verify if the patient is not stable or is not able to identify himself. Fourth, check details against sample request form. Fifth, investigate all discrepancies before proceeding to take the sample. So, these are some of the important positive patient identification that should be done before doing a venipuncture. For patient identification, there are some key points to be noted. They are all patients having blood sample must be positively identified before doing venipuncture. Second is never pre-labeled the sample. Third, the sample tubes must be labeled at the base side by the individual who is taking the sample. Fourth, pre-printed patient labels must not be used. So, these are the some of the key points that are to be noted while doing a venipuncture by a phlebotomist. So I hope you have understand about the patient identification to avoid mismatch or unlabeled sample. So keep learning